If you are brand new to Medicare and you want to know what it's truly going to cost you, then this video is for you. Let's start with Medicare Part A. I'm going to put the card here on the screen, and that's also known as your hospital insurance. Some people refer to it as your inpatient insurance. Medicare Part A is free premium-wise for most people if they have worked either 10 years or worked 40 quarters. However, it's truly not free because you did pay for it through your payroll taxes to FICA. One common question that we get here at Agape is, what if I didn't work for various reasons? Will I still be able to get my Part A premium for free? And the answer is yes, you can still qualify if your either current spouse or your ex-spouse worked at least 10 years or 40 quarters. Most people, it doesn't cost anything for them for Medicare Part A. You could have a premium associated with your Part A if you did not meet the minimum requirements. Next is Medicare Part B, or your medical insurance, and some people refer to it as your outpatient insurance. While Medicare Part A for most people is no cost or free, Medicare Part B does have a standard cost for most people of $174.70 in 2024. Some Medicare beneficiaries will pay a higher Part B premium, which is known as a IRMA penalty, or income-related monthly adjustment amounts, if they had a higher income for the past 2 years. You can see the graph here or the image here on the screen, and I encourage you to go take a look at this. You can take a look at this at Medicare.gov or CMS.gov, and you can get all this information yourself. There will also be some Medicare beneficiaries that will qualify for one of the 4 Medicare savings programs that will allow them to get their Part B premium paid for and other benefits as well. If you feel like you may qualify for the Medicare savings program, then I will put a link in the video description for you, or you can simply call the number on the screen or click on the website link down in the video description. We'll put it on the screen as well, and you can reach out to myself or one of our seasoned Medicare advisors, and we would be more than happy to help you apply for this at no cost to you. If you are getting value out of this video so far, then please take a moment to hit the like button for us, click on the subscribe button, or comment below and give us some feedback. This just helps us get this information to more Medicare beneficiaries like yourself. Right, we talked about Medicare Part A, we talked about Medicare Part B. Now let's talk about Medicare Part C. Medicare Part C, or also known as a Medicare Advantage plan, in most areas is a zero premium or a low premium plan. They take your medical, they take your RX, they take your dental, vision, hearing, and other benefits and put it into one plan for you. One common question I get asked all the time is, do I still have to pay my Part B premium if I'm paying no premium for my Medicare Advantage plan? And the answer is yes, unless you qualify for one of the Medicare savings programs that I just briefly discussed earlier. These Medicare Part C are 1-year contracts, which means you will want to review them to make sure that there's no changes that will negatively affect you as a Medicare beneficiary. And the time that you review these plans is during AEP, also known as open enrollment, and that is from October the 15th through December the 7th. Finally, let's look at Medicare Part D for your prescription drug plan. The average premium for a Medicare Part D plan in 2024 is $55.50, and the deductible is $545 for the year. One important thing to note here is that not all of your drugs will trigger that deductible. These are generally drugs that are classified as Tier 3 and higher. This is why it's important that you have a seasoned Medicare advisor to talk to, so that way they can review all of your drugs and make sure that you're on the best possible Part D plan for your needs. If you do not have someone to help you, We work in most states, and it's no extra cost to use someone like us to help you get this right the first time. So you can simply call the number on the screen. You can visit our website, fill out the contact form, and myself or one of our advisors will be more than happy to help you. Also, what I want you to be aware of is that you could qualify for what's known as LIS, low income subsidy, or extra help, where you can get your drug plan premium paid for, as well as all of your drugs capped and your deductible done away with. If you feel like you may qualify for this program, once again, at no additional cost to you, you can reach out to our team, numbers on the screen, website below, or fill out a site contact form, and we'd be more than happy to help you apply for that. Or you can simply do it yourself by going down in the video description and clicking on the link. This one program, Extra Help, could save you, the Medicare beneficiary, hundreds and even thousands of dollars per year, especially if you are on multiple high-tier drugs that could really break the bank, so to speak. If you need help navigating the whole Medicare process, or you're just confused by what you currently have, or you just don't have someone to talk to help you to answer the questions that you have to make sure you're really understanding what plans you're on, then you can comment below. You can call the number on the screen. You can go to our website, and we will help you at no cost to you. By the way, if you want to take a deeper dive into Medicare, then go to watch my 3-part Medicare 101 series here.